Okay, I want to officially welcome everyone for the November meeting. What I'm going to do is just give a brief presentation, and then I'll open up the lines for questions. But I primarily want the questions focused on the topic, which is chelation and detoxification. So we'll start with those questions, and I'll open it up for anything that you might have. So let's see if I can begin. Oh, one thing I'm going to do, I forgot. I'm going to mute everybody for now, just so there's no background noise, except those of you that are on the telephone. I can't mute you. So make sure that you keep the background noise quiet. So welcome to the November meeting. I got a couple of questions regarding chelation and detoxification. There were a lot of good questions. They wanted to know the best way to chelate. Why should I chelate? What is the problem with heavy metals, a urine test? And I was kind of shocked. I did a follow-up on a lady that has been in the program for a year. And I was kind of shocked that she did not do her urine test yet. I says, why haven't you done the urine test? And she said she didn't really understand what it was for. So hopefully this will clear up some of those questions. As many of you know, I just returned from Senegal, Africa, on a 10-day mission. And there's the map of Africa on the left. And Senegal is part of the west coast of Africa, which includes Guyana, Liberia, Togo, many wonderful African countries. This is my third trip to Senegal. And I was working on the Mercy ship. And we had to cancel our surgical programs rather suddenly because of COVID, and we abandoned well over 100 Senegalese that were scheduled for cataract surgery. So the purpose of this trip was to go back and take care of these folks. It was a long flight. Here's me arriving 11 o'clock at night in Senegal. We flew from Pittsburgh to Miami, which was about a 2-hour flight, and then from Miami to Madrid, which was 9 hours, and then from Madrid to Senegal, which is another 6 hours. And these are two of the wonderful Senegalese doctors I work with. On the left is Dr. Marie, and on the right is Dr. Lena. In addition, it was Dr. Badian, who's the director of ophthalmology at the hospital. And these three surgeons really, really inspired me. They have such dedication and just such a desire to help their people of Senegal. And part of my job, I was over the last couple of years, was training these doctors to some of the new surgical techniques to help their countrymen. And there's the operating room set up there, and my job was to supervise and help make sure that everything was going well. And this is a group of the post-op patients. We operated on well over 100 patients, and it was very, very moving for me because, number one, the people were surprised that we came back. You know, we made a promise that we would come back, even though it took us 2 years. We did make it back to Senegal. So it was very gratifying that we kept our promise for them, and they were just very grateful that an American team, the Mercy ship crew, returned to Senegal to help them. And you can read more about our missions by going to mission2cureblindness.com. All one word, mission2cureblindness.com. I was supposed to go to Haiti this month, but it was canceled because of the unrest. And I do have a trip to Liberia coming up in February next year. Okay, so now let's roll up our sleeves and talk about chelation and detox. Why is it important, and why all of you should be taking this seriously, not only for your eye problems, but for your general health. I'm a big advocate of chelation. There's a strong history of high blood pressure, cardiovascular disease in my family, and chelation, I think, is one way to improve the blood flow to your body, eliminate heavy metals, prevent degeneration of all sorts. Now, there became an interest in chelation during World War II, that when the sailors were painting military ships. They were contaminated with lethal levels of lead. And many of them became sick, very toxic. So they began a treatment to remove the lead. During the removal of lead, many of these sailors had an improvement of cardiovascular symptoms, improvement of energy, improvement of blood flow. So the connection between chelation therapy and vascular disease was kind of made inadvertently during the treatment of these sailors. Now, my early experience, I had an uncle that had severe cardiovascular disease, and he wanted an alternative treatment. And at that time, when I was in medical school, I didn't really know that much about chelation, but I suggested that he try it, and he did, and it greatly improved his cardiovascular symptoms. Also, my late father had cardiovascular problems, and I encouraged him to have chelation, and the chelation greatly improved his reduces cardiac symptoms, and also he was suffering from early Parkinson's, and that chelation improved those symptoms too. So what is chelation? Well, this is the EDTA molecule, ethylene diamine tetraacetic acid. And if you look at that molecule, it's actually composed of 4 vinegar molecules, 4 acetic acid molecules. And it's a huge molecule, and it kind of is like a claw, and chelation means claw. It kind of grabs and binds these heavy metals. These heavy metals are big bullies. They're gigantic molecules that float around in the body, and they wreak havoc. They also block the function of the good guys, the little metals like chromium, zinc, magnesium, all these essential metals that are necessary for enzymatic function. So what the chelation does, it binds these heavy metals and makes them soluble, and then they're discharged in the body. Now, chelation has been very, very controversial, and recently there was a study called the TACT study, Trial to Assess Chelation Therapy. It was a 10-year study, over 130 clinics, 1,700 patients, and the purpose of the study was to answer the question, does chelation have any benefit? So what they did is they selected very sick patients. These were people that had advanced cardiovascular disease. They were either on, 2 medications, they had repeated episodes of chest pain, they had previously had a stent or a heart attack. So these were 6 people. They had 30 weekly infusions, followed by 10 maintenance infusions. Now, this is a controlled study. By that, I mean, one group got the chelation mixture, the other group just got saline, nothing. And the patients didn't know, and the doctors didn't know. So it was a good study. And this is an example of the Chelation Solution. The primary ingredient is EDTA. That's that big molecule that binds those heavy metals. It also contains vitamin C, and you can see some B complex vitamins there and some, other trace minerals. And the placebo consisted of 500 milliliters of normal saline. And so the end result is, this is after the 10-year study, heart disease improved 26%, diabetic heart disease improved 39%, and heart attacks improved 23%. But by improvement, I mean there was a reduction in a major event. By a major event, a heart attack, chest pain, hospital admission. So you can see that in the diabetic subset, they had the greatest improvement. So what can you take away from this? Well, number one is if you're a diabetic and you have any type of eye problem, I would not walk, I would run to the nearest chelation doctor to get treatment. It seems to be an extremely good benefit in the diabetic group. Heart disease, if you have any eye problems and cardiovascular disease, the number one treatment should be chelation. But at the end of my talk here, I think that all of you will agree that chelation should be considered by everyone. And I am actively involved with chelation. In fact, right before I gave this talk, I inserted a rectal suppository of detoxamine. I take my ocular detox every day, and probably once a month I try to get an IV treatment. A really good movie. This is a report called UNLEADED. I don't think this is available right now. There used to be a site where you could download this video, but you could Google UNLEADED, and this is all about the study and the results. I do think we have a few copies of this left in the office. You may want to give the office a call, and they can send you a copy of this. So what are the benefits of EDTA? Well, in addition, and those of you that know me, I believe in a healthy diet, exercise, and a good emotional state. But what if you could reduce your chances of being diagnosed with cancer, heart disease, reduce symptoms of fibromyalgia, chronic fatigue, improve your youth, and even increase sexual capacity? Well, EDTA chelation can do this. It's time-tested over 50 years safety and effectiveness, and the recent TACT study has shown benefit, unrefutable benefit, that chelation therapy does improve the vascular circulation. Although the TACT study didn't look at eye disease, I think it's common sense that you'll agree with me that if you can improve your circulation, improve the oxygenation, reduce toxins in the body, certainly that's going to benefit your eye. Also, it reduces cholesterol levels and moderate blood pressure. I have borderline hypertension, and I think the chelation therapy has helped me eliminate most of my medication. I still take a small dose occasionally because my blood pressure does get up. It also thins your blood to prevent the formation of blood clots, so it reduces the risk of stroke and heart attacks. And one of the common diseases that I see related to the eye are strokes to the eye. We get vein occlusions, artery occlusions, blockage of the arteries, and I think this is the underlying issue with wet macular degeneration. It improves blood circulation. The smallest capillaries in the blood vessels. So this may be of interest to those of you that may have glaucoma, because one of the problems with glaucoma is a decreased circulation to the optic nerve. So some way we could improve the circulation to that optic nerve, there's no question that we should have a restoration of your vision or a marked decrease in the progression of optic nerve damage from glaucoma. Same thing with the retina and macular degeneration. Improving the circulation, open up those capillaries should dramatically improve the blood flow. EDTA is a powerful antioxidant that destroys the free radicals. EDTA has been shown to protect the cell membrane, DNA, enzyme systems. And it may be a benefit in Alzheimer's disease and even some types of cancer. EDTA also increases nitric oxide. This helps to relax blood vessels. There's been some studies that nitric oxide, increasing the levels of nitric oxide also lowers the intraocular pressure of your eye. In fact, there are some new eye drops on the market now that actually increase the levels of nitric oxide. It's also beneficial for the health of epithelial cells lining the blood vessel wall. It keeps the inner walls of the blood vessel healthy and reduce the needs of plaque buildup. So, hey, all these things sound pretty great. One thing that the EDTA chelation does is it removes heavy metals. Let's talk a little bit about heavy metals. Heavy metals are everywhere. Most of us grew up at a time when we had leaded gasoline, leaded paint, leaded pencils, and lead is a common contaminant in our soil. It's in our air we breathe. It's in our water. And I think it's a contributing factor in all chronic eye disease. It's not just my thinking. There have been many studies to show that. So the best way, the most effective way is the 6-hour urine test to see if you have heavy metals. If you would go to the doctor, and many of you had, and ask them to check you for heavy metals, they're going to do a blood test and a urine test. And it's going to come back normal. And they'll say there's no problem. Well, the fact is that if you have been exposed to lead, lead doesn't stay in your blood and your urine. It goes into your bone, your brain, your fat, and other tissues. It's locked in there. So in order to properly measure you for heavy metals, you need to get a chelating substance. This chelating substance goes in there. It kind of releases those heavy metals. Then we can measure them in your urine. So the way the urine test is done, you take a couple capsules of DMSA, which is a chelating agent. That binds the lead and mercury, cadmium, and other heavy metals. And then we collect it in your urine. And this is the urine test that we use. I like this test. It's a simple test. You do it at home, put a small sample in the mailer, send it to the lab. We get a report. We call you up and tell you the results of the test, and we recommend treatments for you. And most of the patients that I have seen do have elevated lead and mercury. Some of you, the lead and mercury are off the chart. Other, it's slightly elevated. My lead and mercury were off the charts. Now, after many years of chelation, it's starting to come down to a much lower level, but I'm still continuing chelation simply because it's helping my cardiovascular system. And here's an example of a test. We get a complete rundown of all the heavy metals, aluminum, arsenic, cadmium, etc. And in particular, we're looking for this PB, palladium, or lead. And in this patient here, they were in the red zone. This is when we have to treat it. So I think that over 80% of eye patients do have elevated lead. Increased lead is linked to cardiovascular disease and increase in eye disease, especially cataracts. There have been numerous studies to show that elevated lead is linked to cataracts. So heavy metals removed from the body by EDTA. Not only lead, but mercury, aluminum, arsenic, cadmium, and uranium. So you can see that the EDTA chelation is very effective for removing all these toxic heavy metals. So let's talk about the different ways of doing chelation. Probably the best way is intravenous. Intravenous is the most effective because we know that 100% of EDTA is going into your body through a vein. Unfortunately, it's the most expensive. You're going to be paying between $100 and $200 for an IV treatment. Also, it requires you going to the doctor's office, time spent. Of course, with COVID now, that's another problem. If your lead or heavy metals are off the chart, and if you have serious eye disease and you're losing your vision, I would highly recommend that you consider intravenous. And you can do as many as 1 IV therapies a week. A more practical way is the rectal. You can use a suppository, and that's what I do. Rectal suppository 3 times a week, Monday, Wednesday, and Friday. The rectal suppository contains EDTA, although the effectiveness is not as great as the intravenous. Only about 25% of the EDTA is absorbed in your body. Another method is topical. This is a topical lotion and cream. I don't recommend that for my patients. Typically, this is used for autistic children in other situations. And the other one is oral. And we have a product called Ocular Detox, which I'll talk about. So my protocol is doing the rectal 3 times a week, and I do the oral every day. That's part of my program. And then when I do have time, when I'm back in the office, I may do an IV treatment once a month. And this is an example of the IV infusion. Most of the ingredients is the EDTA, but there's a high amount of ascorbic acid. Ascorbic acid is a chelating agent in itself. So by eating more citrus fruits, that does have a chelation effect. These are the 2 products I recommend. Detoxamine on the left, either the suppositories, and Ocular Detox. And for more information, you can go to detoxnow.us. Right down below, I have a description on all these ingredients. Now, the Ocular Detox, these are capsules, and this is kind of like my pride and joy. I helped formulate this. This has garlic, Garlic is known to have a effect on regulating cholesterol and lowering blood pressure and reducing plaques. It has tyrosine, taurine, hawthorn berry. All these ingredients are very good for the vascular system. In addition, of course, it has high amounts of the EDTA, a couple of grams of EDTA, coenzyme Q10, ginkgo biloba. As many of you know, ginkgo biloba improves the circulation. Now, the company that makes detoxamine recently came out with a combination of glutathione, which I like. You know, glutathione is a powerful antioxidant, and in combination with the EDTA, I think it's a great mix. And this is something that I switched over to. Now, the benefit of chelation is amazing, but at the same time, it may remove some of the good minerals in your body. And this has always been a concern of my patients. But the EDTA molecule has about 1,000-fold greater attraction to the lead, mercury, cadmium, those heavy metals. So I do recommend that while you're on the chelation, you do take a mineral supplement. And this is the mineral supplement I recommend. It has a wide spectrum of minerals that are essential. So we do have a special offer, which includes the urine test, detoxamine, ocular detox, and the spectrum chelate, all 4 of these products to help you get started on your detox program. So we're giving you a 20% discount on these products, which is a pretty good saving. You're going to save over $100. I do think this is a very important step that you need to take. Those of you that are doing the chelation, continue it. Those of you, like that lady I talked to, the urine test is still sitting at home and you haven't got around doing it, please do it. Those of you that have been in the program maybe for about 6 months, it's time that we repeat that urine test. Look at those heavy metals. And I'm going to close by saying, if you are not satisfied with your vision improvement, or let's say maybe you started the microcurrent, you had a good improvement, now you reached a plateau, and you're not doing any type of chelation, this could be the trick to really turn things around for you. Okay, let me see here. I'm going to open things up right now. I think that everybody's unmuted. And we have some people on the phone and some people talking. So you can fire me some questions. Let me see if my chat is open too. So you can write a question to me or just fire away.
Dr. Kondrot?
Yes, if you could state who's talking. So
yeah, this is Roberta. Yeah, how are you?
Hi, Roberta.
Okay, I'm still not seeing any improvement, and I sent down the urine thing, and she said I should have taken the pills, but they weren't included in the box. So now I don't know what to do.
Well, it's essentially you take the test with the pills, because if you don't, your results are going to come back normal. But I would recommend forget about the test. I think if you're at the state, how long have you been doing the program?
3 weeks, 3 months and a week.
Okay. Well, that's the point of time where you should have an improvement. So there's a couple of things we need to do. Number one, we have to look at your microcurrent program.
Right.
I want to optimize that. Number two, we have to look at your homeopathic remedy, see if that's the best remedy for you. And number three, I do think that you should get started on the chelation program. Even if your heavy metals are normal, let's say you don't have anything, chelation is still going to help improve your circulation, improve the function of your eye. So that's what I would recommend.
Crystal gave me a price of over $300. Is that what it should be?
I'm sorry, you're breaking up.
Crystal gave me a price of over $300. Is that what it should be?
You'd have to talk to her. $300 for what?
Chelation therapy something package, she said?
No, here's the website right here.
Okay.
It's much less than that.
Oh, good.
Detoxnow.us.
Okay.
You get everything here for a saving of $100.
Oh, perfect.
So
And
go to
should I-
detoxnow.us.
Perfect. Detox now. Okay. Should I do the 3-month checkup thing with you privately?
Definitely. I'd like to look at your records. Now, you told me that there's no change.
No, in fact, it got a little worse.
Well, if it's gotten worse, I need a copy of your eye records. I have to find out why it's gotten worse.
Should I go and have them done again?
Definitely. If your vision is getting worse, I want all my patients to have an improvement of vision. If it's worse after 3 months, you need an eye exam.
Okay.
Then
Should I go
I can look at the records and say, okay, it may be something simple like the doctor tells you, oh, you just need a new pair of glasses.
No,
Your
no.
glasses are too strong.
No, the spot is getting a little bigger.
Well, then we need an eye exam. I need pictures and send it to me.
Okay.
Then we can evaluate it. We have to make some changes.
Okay, good. All right, so I'll do that and then I'll make the 3-month thing.
Yep.
Okay, good. Perfect. Thank you.
Okay, thank you. Okay, any other questions? I hope all of you are doing the chelation.
I did have a question. I am doing the chelation. How many people at the end of 6 months have an improvement in their heavy metals?
Boy, that's a good question. You're putting me on the spot. It varies. Unfortunately, some people have an increase in their lead and mercury. And I have a lot of patients that are upset that what is happening is we're mobilizing the lead and mercury in your body. You know, lead has accumulated in your body over your lifetime. The half-life of lead in your body, by half-life I mean how many years will it take for half of that lead to leave your body naturally? So let's say you have 1 gram of lead in your body. It's distributed everywhere. How many years would it take for that 1 gram to go down to a half a gram?
It's 99
years.
Yeah.
That's scary.
Yeah.
So
okay.
It's tough. Now, I've been doing chelation probably for close to 30 years. My lead was off the chart. I grew up in Pittsburgh, Pennsylvania. When I was a kid, I had to sweep dust and dirt off of my car. It was so polluted in Pittsburgh. When it's the water, we breathed it. So my body is full of lead and mercury. And I've been doing the chelation for all that time. And there's a strong history of heart disease in my family. I'm mainly doing it for cardiovascular benefits, but it is benefiting my eyes. I mean, I'm 71 and I'm still doing, microsurgery, and my vision's pretty good, knock on wood.
Okay. I did want to ask you, I did have the test done on my daughter and she came up really high on mercury. And she eats sushi. And I tried to tell her that that could be causing it because it shouldn't be higher than mine.
Yeah, well, the sushi, definitely fish. And also, does she have any dental amalgams?
She doesn't know. I had them when I was pregnant with her. I have now had them out. So she probably has that from when I was, when she was in utero.
Yeah.
So
I would recommend that you probably see a functional medical doctor to have her evaluated. There's a couple of different websites. One is acam.org, acam.org. And I think the other one is A4M, apple4mary.com, or you can Google A4M. Or talk to Crystal. I think we have a list of sites for alternative doctors.
Well, I was going to just put her on the same stuff I'm on. Can I do that? Or should you think she should?
I would be careful. She should be probably under a doctor's supervision. They may recommend a different treatment. They may recommend a treatment more specific for the mercury. Sometimes DMSA is used. It's a little bit more specific for mercury.
Okay, well, she's high in lead too, or in the middle range of lead, so.
But I
Okay.
do think that she should probably, see a good functional medical doctor. Where do you live?
Well, she lives in Athens, Georgia. We live in
Mm.
Georgia.
I'm trying to think if I know anyone in Georgia. But I would go to ACAM, acam.org.
Okay, and then just show that doctor the results from her test?
Yeah. Now, make sure they're a functional medical doctor or a naturopath, because if you go to a traditional medical doctor, he would probably repeat the test and will come back normal. He'll do a blood test and urine. Now, a blood test and urine test will only check for active exposure.
Right.
So in other words, if she's actively being exposed, her blood and urine tests will be normal. But the test that I recommend, the challenge test, checks for all that lead and mercury that are deep inside your body.
Well, right. I ran your test on her.
Mm-hmm.
So
Okay.
she did the chelation test. So the test that she has is the same one that I took, and it showed high in mercury and middle range in the yellow range for lead.
Mm-hmm.
So
But I think the sushi may be the culprit.
you think the mercury would be the sushi?
Yeah, if she loves the sushi, our oceans are contaminated, especially with mercury.
Uh-huh. Do you think that if I put her on this detox program of yours that it would help, or you really think she should see another doctor?
I would recommend she sees another doctor, especially at her age, being this high.
Uh-huh. Okay.
She needs to be under somebody's care that really understands, the dynamics of it.
Okay. All right. Thank you.
Okay, thank you.
Dr. Kondrot, this is Rudy.
Rudy, how are you?
Good, how are you?
Pretty good, exhausted.
I'll bet. That's pretty amazing stuff that you do, I have to say. God bless.
Thank you.
I am currently taking IV chelation therapy twice a month. I can't afford to continue with four times a month. That's just a little salty for me. But I would like to.
How expensive is the IV?
I'm sorry?
How expensive is the charge for the IV?
Well, I also get glutathione with it, so it's about 200 and change a shot.
Yeah, that's kind of steep.
Yeah, so I'm good with twice a month. But my question is, I'd like to take ocular detox in addition to that, especially for the off weeks. But I'm not sure what dosage to take.
I would recommend, everybody's different. A full dose is 6 capsules a day. That's what I do. I do 3 capsules in the morning, 3 capsules at night. That's how I'd recommend. But it's kind of tricky because you're getting the IV therapy. You may want to maybe only take 2 capsules twice a day and see how your body tolerates it. And I'm sure the doctor is putting you on some type of supplemental minerals.
Yeah.
Good. You might want to consider the spectrum chelate, the mineral supplement.
Thank you, Dr. Kondrot. I appreciate that.
Okay, thank you. Ken, how are you? Pretty good. I'm not familiar with that. I just don't think it's necessary. I wouldn't combine those therapies. I mean, I think the vitamin D3 is important. Many studies have shown that vitamin D deficiency is linked to chronic eye disease. And of course, studies have shown it has a protective effect for viral infections, particularly COVID. I'm taking 5,000 units a day, but I really. What's that? Oh, you're talking about the niacin. I thought you were talking about D. Yeah. I don't know if that would have any benefit. I would not mix it with the chelation. The chelation is a standalone treatment. I don't think it's necessary that you flush your body or increase your circulation by that method. No, I really can't comment on it. That's the treatment that I don't recommend. But there's a lot of a lot of different approaches out there and different therapies, and we're kind of all in this together. I probably learn more from my patients than I do from medical meetings. And one thing I do advise is that when you start the program, for the first 3 months, you only do what I recommend. You continue doing everything that you're presently doing. Don't really drop a treatment. If you're getting massage once a month or you're getting acupuncture treatment once a week, you continue everything. Don't start anything new. Because if you start something new and there's an adverse change or a benefit, we're not going to know what caused it. But at the end of 3 months, like Ken mentioned, hey, try the niacin. And if you have a dramatic improvement, then that's something definitely share with me and share with the group. And that's one of the reasons why I set up the Facebook page, the private Facebook page. So I hope that all of you are on that. You can post questions and share things, and so we can have a community regarding things that we're doing to improve our vision.